Yeah, I know, right? All right, so hi, I'm Dr. Nikita Vizniak with the amazing
Dr. Catherine Chung
and the amazing
Beth Guirr.
And today we're going to focus on some differentials and treatment of the cervical spine and head. So we're going to focus on upper back, neck, and head treatments, and we'll talk about some of the key things that you want to keep in mind when you're doing and working on these areas. So first thing, I'll go ahead and start. One of the key things that I like to focus on is making sure we have a correct differential diagnosis and knowing we're working on the specific tissue that is actually causing the injury or the symptomatology for the patient. And we do that through our range of motion assessments, through our orthopedic testing. Imaging potentially can give you some good information, but we're looking at putting all of this critical thinking together to come up with a working diagnosis or differential diagnosis on the patient. Dr. Chung, what are some of the key things you feel like we have to focus on?
Well, outside of that, clinically, I find that at-home treatments are just as important as in-house treatments as well, because I only really see my patients once a week, but you really need more than once a week treatment to get better and be pain-free. So a lot of the things that I talk to my patients about is being more mindful of their body, especially when it comes to at work and being in a stressful environment. I bet at home right now when you're watching the camera or the video, I guess, your shoulders are pretty much up to your ears and you don't even realize it. So how about we just relax those out, and then you can actually feel the difference. And that's kind of the cues that I talk to my patients about stress management a lot, but specifically keeping those shoulders down and elongating that neck as much as possible.
All right, nice. Beth, what do you think?
I want to just bounce off of that. So when we see you for maybe an hour or even less, that's only 1 hour in your week. You've got 24 hours a day, so that home care is important. So bang on for that for sure. But what I'm going to be looking at is your soft tissue. So I'm going to be looking at trigger points. I'm going to be looking at your structure, looking at how your spine is moving, and doing some joint mobilizations.
All right, excellent. So we're going to go ahead and start and do some demos of some of these treatments, and hopefully you'll find this very useful.
What I like to do is start with my patient face down. If they've got a headache, I will actually start with them face up. Just gives them some time to relax and get used to the table as well. But that being said, what I like to treat is your traps. So because your traps go all the way into your neck, it's an important part to treat, even the lower parts. So that's where we're going to start. All right, so just tucking her in. Nice and cozy. And I will generally just assess the area. So I'm going to start with some shearing along our upper trap portion here. We're going to get into splenius, left scap. We're going to be crossing all those muscles, just seeing what the tension is like, going into each direction, seeing if there is more give on one side versus the other. Okay. I'll do some mobilization of our scapula. Because our scapula has that levator scapula that attaches into our neck, I want to see if there's, again, restriction, if there's some lack of movement. Hers looks really good so far. So I'll do both sides. Always check bilaterally. This one's a little bit more stuck there. And with palpating the top of our left scap, she does have a little bit more restriction on that side. You notice that too? Mm-hmm. All right. So another thing I like to do is also pick up the traps, right? So I'm picking it up in like a motion of bowing almost. And we got a little bit of a give there. If it's uncomfortable, just let me know right away, Catherine. Yeah. So this is where trigger points usually pop up. So this is all lotion free. So generally, I will start the treatment lotion free. It's a bit of a trigger point in the upper trap on this side as well. Then I'll look at infraspinatus. Just looking at this whole upper portion is really important. So this whole upper section, then getting into the neck. Something that I really like doing and that my patients love is going into the cervical posterior muscles and just pulling it up. So grabbing it like a pincher motion and just pulling it straight up into the air. Again, that's something that I'll hold for a little while. So jumping into it, I'll put some lotion on. I do have lotion and oil, depending on the technique that I want to do. If I want to be able to get more friction or grabbing motions, I'll use lotion because it gives me a little bit more traction. Oil is going to be a little bit more gliding. So just warming the tissue up. What I'll do is I'll take my hand in like an L shape and I'll go along the upper superior border of our scapula. Again, that's going to be getting your traps, levator scapula, some supraspinatus. We had a little bit of a bump there. I like to call those speed bumps. And yeah, I feel lots of that tension in the upper trap insertion here. All right, and so then the motion with, again, picking up, I'll actually shear it. So picking up and going along and almost stripping and shearing at the same time. If you can see that from up above. I also pull my hand down in a motion that allows me to get, again, another stripping motion. So with patients that come in with neck pain, I'm going to ask them questions if they get headaches a lot, if their neck pain is caused from anything, whether it's work related or if it's posture related. I'm also going to ask them about where their headaches are, and that's probably the most key thing here actually. And if you find out that you get a lot of that tension that's referring into referral patterns like the TMJ, you can treat for the jaw as well, and you can see that in one of our other videos if you go through our history here. So another thing I really like to do is take a seat, and I'll go through again that border with an L shape, but I'll be targeting more of our supraspinatus. So you can see that I'm kind of almost, there's like a groove or like a highway, so to speak, where there's a little bit of give through our muscle. It's hard to describe, but you can feel it. As soon as you put your hand in that spot, you'll feel it. It's like a little, like a ditch, and you can go through with your thumb and strip it. And then for trigger point releases, we got a bit of a twitch there. What I'll do is I'll hold it. And it's as simple as that. Go and hang out. If you've got a really bulky person with lots of thick muscle, using instrument-assisted soft tissue tools are super helpful for this. That way you're not using your thumb and loading and killing yourself, because you could sit here for a while if you've got a big trigger point. Something that I also like to do is when I'm treating into middle or lower traps, what I'll do is I'll strip along almost rhomboids and find a spot that I feel like is a little bit of a twitch. So we got a response right there. How are we feeling, Catherine? Is that okay?
Yeah, it's intense, so it's good.
Do you want me to back off a little bit?
Nope, it's good intense.
Okay. So what I'll do is, if she's okay with making it a little bit more intense, I'll grab her arm and just relax as much as you can. And what I'll do is I'll bring it up and just getting a little bit more of a motion and bringing it down. So it's just kind of spreading that muscle. Get something a little bit different. Relax as best as you can. There you go. I find that movement is huge in treatment. If you want to be able to get through a trigger point or a restricted area, moving around that muscle or moving around a joint around the muscle is so important, even if it's just wiggling back and forth, because you're going to be getting a lot more space. It's going to be able to get the muscle in a lot more direct, and I don't know what I'm getting at there. It's just better. All right, so I'll spend a while face down working through the neck, but what we're going to do for time's sake is get her turned over. It's okay, I'll just do this all day long. Poor patients. Okay. So back into neck. So now we've got our anterior areas here, right? So we've got our scalenes, we have SCM, we've got some of our pecs we can even work into. Depends on where, again, they're feeling it. So if you've got a bit of a trigger point referral, go for it. Find that area, know that muscle. Study up your trigger point referrals. Also listen to where the patient says, it's sore, it hurts there. All right, so what I'll do is I've just got her head turned. My hand is underneath here, as you can see. This allows me to have motion with moving her if I need to. And this hand is free to do as it pleases as we move around. Again, we've got upper.
Right there.
Want me to back off a little bit?
No.
Okay, this is where I'll get some more active movement in here. So loading into that spot, I'm just hanging out and holding it, but I'm moving her neck around. Again, picking up. I love picking up. I think it also feels good on our shoulders, just to have our shoulders lifted up. Feels great. So you can work into scalenes here. What I'll do is almost like a GTO release, but then I'll also get that movement. I'll get her to bring her ear to her shoulder. You can make this active if you want as well, where she does it herself. Depends on how their threshold of pain is or soreness, just by doing it passive. If they're go-getters, they'll be all over it.
What's GTO?
GTO is a Golgi tendon organ. So when you hold it, it basically releases the muscle in a sense. It pretends, the muscles recognize pressure and stretch. So when you hold onto it, it thinks that it's being stretched. And so as you prolong it for about 30 seconds plus, it'll actually relax. Good question. Patient education is a huge thing for me. I love teaching during treatment. Last week I taught 2 little 9-year-olds what their patella was.
Oh, cute.
They go, oh, it sounds like Nutella. I'm like, yeah, just remember that, Nutella patella. All right, so this is where I can also work into SCM. Are you okay with me picking it up?
Yep.
So SCM is kind of slippery to try and pick up just with your hand. So I like to use the sheet or the face piece. So let's use the face piece for this. Put it around your hand. This lets you grab it and have more secure grip. It's a bit restricted on this side. So when I say it feels restricted, it just feels like it doesn't want to be picked up. It just feels like it's like glued in there and doesn't want to move. So my goal again is picking up and mobilizing. And by mobilizing, I mean just really gentle little wiggles. I'm not talking like reefing. I'm talking just little tiny movements. And I'll do that through the whole belly. So I'll go up towards where the ear is and I'll go down towards the clavicle. Clavicle is kind of hard because it does get a little bit choky feeling in that area. So what I'll do is I'll usually do just the GTOs or origin and insertion technique, which is doing a GTO basically on each section and then getting them to actively move that muscle. So to show you what that looks like, I would hold this for about 30 seconds. And then, are you okay with that? I saw a bit of a twitch.
Yes, this is good.
And then I would hold this for 30 seconds here. And let's say that I already did that. And I'd have her turn her head and relax. And then just lift up to my hand here. Perfect, and that's it. And that's origin insertion technique. So cervical treatment is probably one of the most common things I'm treating. A lot of people are coming in saying that their shoulders are sore and they point to upper traps, they point to their neck. Usually the base of the skull is a common one, so I'll spend quite a bit of time working on our splenius. I'll try and get to those suboccipitals, but they are pretty deep. This is where I'll also add a lot of joint play. So I'll do some cervical distraction. So what I'm doing is just using my body to lean back. I'm not even using my hands really, I'm just anchoring in. Something I want to point out is as therapists, I've noticed through my treatments that I've gotten from other therapists is they dig their thumbs into my temples. Try to make sure you're using only your fingers at the base of the skull. Don't be digging your hand into the temples and causing a headache there. I'll also do some PA glides. So I'll go basically to around T4 and I'll just do some gentle PA glides. And then coming up to the cervicals, where I'll also do lateral translations, and that's what I really like too, is feeling those areas. And if they do have stuck spots, of course you can do some MET, muscle energy techniques, to work those out, or send them to your local chiropractor.
Do you want to do an issue with that really quick?
Yeah, I can. I was gonna do it actually when she's seated, because I really like doing it seated. So I think that's pretty much what it would look like. What we'll do is we'll get you seated in a second here. So for the ProStim 1 and ProStim 2, we have these great awesome tools that can be used to basically amplify your treatment in a little bit more of a direct way as well. My recommendation when you are using them is to keep them warm, whether that's in your pocket or if you heat them up under some water. If you've got a table that heats up, you can put them on there as well while the patient's lying down. This is so that you don't shock them with a freezing cold tool, okay? So unless you're intentionally doing that. So what I'll do is usually I'll start with our ProStim 1. And what I'll do is I'll work on the upper traps in this position. So what I'll do is I'll get you to bring your left ear to your left shoulder for me. Great. And so then what I'll be doing is working along this whole border here. So I'll be taking the blade in this position and I'll just be bringing it down. So I always start quite light, get them used to it. Also, you're feeling this at this point. So you're assessing the tissue, seeing if there's an area of like a stuck speed bump. That's what you're looking for. So quite light. And then as you kind of start to feel things, that's when you can start going through it a little bit deeper and always checking in with your patient. How are you feeling with that pressure so far?
No, it's great.
Okay.
Yeah, it's not too intense.
Good, good. So the only thing is that you might get some redness after this, but that should go away. So you'll see redness too at the end of the treatment, and maybe we'll zoom up on that at the end. What I also will do is, if I'm trying to get more at the top insertion here, the back of her neck, I'll actually use the spoon shape on this one, and I'll just use like slight gliding motions. Actually, I wonder if we can get her turned at this point. What I'll do is then I'll use the spoon shape just to kind of go along the base of the neck here. So I'm just going to turn my hand so you can see what I mean. So in this position, this is going to be getting the upper traps a little bit more directly again. Hers don't feel too stuck there, but I've had some patients where they do feel quite stuck, and that is an excellent way of using this tool as well. What I also will do is, now that your ear is to your shoulder, I'll get you to bring your chin to your chest as well. Perfect. So again, we're getting that muscle stretched out. You can of course use different angles. If you want to get more precise and more specific, you can go in with the convex side. It really depends on what you're trying to target, okay? So you can do a lot of things. If you want to try and get the insertion of our traps in that tiny little crook, if they're comfortable with it, you can actually use the pointed end and just work in and almost do a trigger point release. So like I had mentioned earlier, if you don't want to use your thumbs to jam in there and really like hurt yourself, you can use the tools. And this is taking like nothing from me. And I don't know if this feels like a lot of pressure to you, or how's it feel?
No, it feels like it's more pressure than you did with your fingers when we were doing the prone treatment.
Nice.
But also I'm feeling a lot more referral going down the deltoid, but also up into the upper trap as well.
Well, there you go.
Yeah.
And this is nothing. I could sit here all day. Easy. So that is how I would also use some soft tissue tools. I like to also end just with a little bit of my hands going through and gliding it, just to soften up the tissue, just to make sure that they feel really nice and completed, so that they're not just jammed with the tool and then ending treatment like see you later. So end with some soft, nice effleurage. And that's it. That's how we end our treatment. It's really easy, super effective, and you can do it at home too.